What is the primary purpose of safety data sheets, or SDS, in a medical setting? So we've seen SDS mentioned in some other questions, and we've described this as the yellow binder that you'll have in healthcare facilities with SDS, and the reason why this is important to have in the healthcare setting. So we will discuss that when we look at the choices here. So option A is to provide guidelines for patient care, and this is a very general type of answer. I mean, this could potentially involve a patient if the materials being discussed in the SDS was something that they came in contact with, but it doesn't seem really that likely. So we could consider it, but it's probably not the correct choice. Option B says to list potential side effects for medications, and that's not correct. We can eliminate that because the SDS is not for medications. It's actually for hazardous chemicals and how to handle them and what to do in the case someone comes in contact with them. So option C here says to provide information on the properties and the safe handling of chemicals. And that sounds exactly what the SDS is intended to do. And we could go with option C. And that means that when we could go back, we weren't sure about option A, to provide guidelines for patient care. No, that's pretty general, and that doesn't really describe what the SDS really is. So we could go back and eliminate that again. And then looking at option D, to document patient allergies and reactions, and that's not what the SDS is either. So that leaves us with option C, which is correct, provide information on the properties and safe handling of chemicals.